Hi, I'm Dr. Joel Churach. One of the increasingly more popular procedures that we're performing in our clinic is our stem cell intravenous therapy. And we use our stem cell intravenous therapy for a number of different reasons. We use it to treat autoimmune diseases like multiple sclerosis, Crohn's disease, rheumatoid arthritis, also neurodegenerative diseases like Parkinson's disease, and a host of other chronic diseases. We also use our stem cell infusion therapy as a means of stopping and reversing potentially the aging process. So it's a great anti-aging agent, and we have many patients that come in on a regular basis for an intravenous stem cell procedure to help with anti-aging. So the way that our intravenous stem cell therapy procedure works is we use umbilical cord stem cells. And so in our umbilical cord stem cell donor sample, there are 80 million stem cells that we use. We don't use a patient's own stem cells in the intravenous stem cell therapy procedure. The reason being that when we do the extraction process and we get fresh stem cells from a patient, that also comes with blood factors that can increase clotting. Now, this helps if we're injecting a joint or treating locally for an arthritic condition or to treat a ligament or tendon, but we don't want to use that in an intravenous setting because of the potential for clotting. So obviously we want to make sure that our procedure is as safe as possible. So what we use in our intravenous procedure is we use donor umbilical cord stem cells, 80 million of them, and we also use exosomes. And what exosomes are packets of information that are released from stem cells that increase healing, decrease inflammation, and work a little bit faster than the stem cells themselves work. But we use a combination of both of them. And we do this by infusing it intravenously over the course of about an hour. The effects of the stem cell therapy, intravenous therapy, can be felt fairly immediately because the exosomes work almost right away. So people will describe increase in energy, a decrease in pain, a decrease in inflammation pretty soon after the procedure. The stem cells themselves will continue to work for several months. So initially patients will feel sort of a boost of energy, a reduction in symptoms, and then over the long term, those symptoms will stay at bay and start to reduce over time. So if we're treating an actual chronic disease, people will notice their incidence of flare-ups are reducing, the pain and discomfort associated with those symptoms will reduce, and that will continue, like I said, for many months. So if we're treating a chronic disease, and even if we're using it in an anti-aging application, we recommend that a patient comes back anywhere from every quarter to every year, depending on what the results were from their initial infusion therapy. So we monitor the patient's symptoms after that first procedure to see how well it's working to determine what their frequency of repeated infusions would be. It's a great application for anti-aging. It's a great application for treating systemic diseases because, again, it's not treating the symptoms, it's treating the root cause, which is the inflammation. If you have any questions about our stem cell infusion therapy procedure, please reach out to one of our clinics and our patient coordinators will be happy to answer any of your questions.